When we talk about how the heart beats, it's important to understand that the heart does not wait for nerves to tell it when to contract, because it has its own built-in electrical system that creates and spreads signals in a regular pattern, and these signals make the chambers contract in the right order. And once we understand how these signals move, the basics of the ECG become more easier, because the ECG is simply a way of recording that electrical activity from the surface of the body. The heartbeat starts in a small group of cells in the right atrium called the SA node, and these cells can create electrical impulses on their own without needing any outside input, and the SA node sets the pace of the heartbeat in most people, which is why it is called the natural pacemaker. And when it fires, it sends a wave of electricity across both atria, making them contract and push blood into the ventricles. And this step begins every normal heartbeat. After the signal spreads through the atria, it reaches the AV node, which sits between the atria and the ventricles. And this node slows the signals for the brief moment, and this delay gives the ventricles enough time to fill with blood before they contract. And without this pause, the heartbeat would become uncoordinated, and this controlled delay is one of the most important steps in making the heartbeat efficient. From the AV node, the electrical signal moves into the bundle of Fis, and then the right and the left bundle branches, and finally into the Purkinje fibers that spread through the ventricles. And these pathways make sure the ventricles receive the signals almost at the same time, so the contractions is strong and coordinated, and this quick spread of electricity allows the ventricles to pump blood with the force the body needs. The ECG does not measure the strength of the heartbeat, but instead records the electrical changes that happen as the heart goes through each part of the cycle. And the electrodes placed on the skin pick up tiny electrical signals and draw a pattern on the screen or on paper, and this pattern helps us understand whether the heart is beating normally, and each part of the ECG tracing represents a different part of the electrical activity. The P wave on the ECG represents the movement the atria receive and signal being to contract, and it reflects the depolarization of the atrial muscle, and this wave is usually small and smooth, and when it is missing or changed, it can mean the electrical activity in the atria is not normal, and seeing a clear P wave tells us that the SA node is firing regularly. The QRS complex is the largest part of the ECG tracing because the ventricles have much more muscle than the atria, and when they depolarize, the electrical activity is stronger, and this complex shows the movement the ventricles contract, and the shape and width of the QRS can tell us how well the electrical signal is moving through the ventricle pathways. And if the signal is slow or blocked, the QRS often becomes wider. The T wave represents the ventricles recovering electrically after they contract, and this step is called repolarization, and the ventricles cannot contract again until they finish this recovery process. So the T wave is important for understanding the timing between beats, and changes in the T wave can reflect issues with electrolytes, blood supply, or the heart muscle itself. When the SA node fires regularly and the electrical signals move through the normal pathways without delay, the heart is said to be in a normal situation, and on the ECG this appears as a repeating pattern of a P wave, and QRS complex and a T wave at a steady rate. And this steady rhythm shows that the heart's electrical system is functioning the way it should. The electrical activity of the heart controls the timing and coordination of contractions, and when the electrical signals are normal, the blood moves through the heart in an efficient way. And when these signals change because of disease, injury, or imbalance, the heart may beat too fast, too slow, or in a disorganized rhythm, which affects how much blood the body receives. And this is why understanding the electrical system and reading the ECG can help explain many common heart problems.